Now we're going to shift over to small town America, where unfortunately 46 million Americans face additional stigmas and barriers when it comes to seeking eating disorder treatment and support. But our friends at Rural Minds are working to change that. So I'm excited to welcome Chuck Strand, who is the executive director at their incredible organization, along with Gideon Whitehead, who has lived experience with anorexia and ARFID while living in rural America. So without further ado, let's get this conversation started. Gideon, I want to start this conversation off with having you share a little bit about your lived experience of being in a small town and battling an eating disorder and just kind of, take us into that experience and what that was like.
Yeah. So, I've born and raised in Western New York, so nowhere near the city. Um, and for me, I have two primary diagnoses, ARFID and anorexia. And with the ARFID specifically, the treatment already is very new with that. And at the time, while I was growing up, it wasn't even a diagnosis, like officially in the DSM. And so a lot of it was just, well, if he gets hungry enough, he'll eat, which isn't really how ARFID works. And I consider myself very fortunate that I grew up with a family who kind of had the mentality of like, you know what? He's a weirdo, but he's our weirdo, and we will make sure he is fed.
Yeah, that's awesome. Could I ask for a minute, what is ARFID for folks who are listening right now who might not know what that is?
Yeah, so ARFID is avoidant restrictive food intake disorder. And there are a lot of subcategories of ARFID. For me specifically, it's tied closely to sensory issues. I am autistic, and unfortunately, meals and just food in general is a very sensory experience.
And so what was that like having, realizing that you've got ARFID and battling this in a small town? What were the resources like? Did you have to travel far to find assistance? Did you have to turn to the internet? What was that like?
So I ended up turning to the internet because, like, along with realizing, like, oh, I'm autistic, I realized I'm not the only one who, at the time, I classified it as like, I eat weird and I'm picky. So it was really beneficial to like find a community of other people being like, oh, yeah, no, same. The idea of wet pasta makes me want to cry. And I found that sense of community within it just because, you know, I wasn't the only one.
Yeah. And it's one of the interesting dynamics that I've come across is that eating disorders are so isolating. They already isolate you. So then if you're living in a smaller town, you feel even more isolated because you've got that physical isolation from folks, and it can be very difficult to find your community, even though you're in a town where oftentimes I think a lot of people, when we think small towns, we think community and everybody knows everybody and everybody's there to support everybody. But it can be very difficult when other people don't understand your experiences and what you're going through. So I would love to bring Chuck into the conversation here just to talk about, Gideon, you've already shared some of the barriers, but Chuck, what else are you seeing out there when it comes to folks accessing mental health support in rural America?
Well, there are a lot of challenges and barriers, both from the geographic, technology standpoint, but there's also lifestyle challenges. But I think at the top of that list, it's really the stigma that surrounds mental health, mental illness, and unlike diseases such as cancer, cardiovascular, or diabetes, some people don't recognize mental health conditions as illnesses. Instead, some people see a mental health condition as a personal weakness or a character flaw. And this really adds misdirected and unfair shame to the struggles of someone who's already dealing with a mental illness through no fault of their own. And this type of misunderstanding and lack of information about mental illness really is the root of the stigma that surrounds the topic. And it's making people feel uncomfortable about talking about mental illness. That's what stigma is all about, as far as the root cause and why it's such a harmful mindset. But personal, sharing personal experiences about struggling with a mental health condition, it really is the greatest barrier to mental. It's breaking down that barrier and we're working toward mental wellness. And because, like any other problem, the first step to improving mental health in this case is talking about the problem. But this also requires tackling the stigma that surrounds mental illness. And just speaking openly and honestly about mental health helps people share they feel like it's okay. Once someone hears someone talking about it, like getting and sharing your story, I'm sure is going to inspire a lot of people to, even if they don't necessarily speak openly about their situation, they're going to know that they're not alone. And to your point, Jason, about people feeling isolated and alone in rural communities, that's more pronounced. But no matter where someone lives, you can still feel isolated and alone. So until you hear somebody that shares your struggle, which is, both of you have mentioned this already, but it just really is so critical to breaking down the stigma. Having the open forum to talk about what the mental health condition might be, and letting other people know they're not alone. But it's these potentially uncomfortable conversations really are the only way that we can work together to destigmatize mental illness.
Yeah, absolutely. I think about my own personal experience. When I was diagnosed with my eating disorder, I was living in Denver. So I was in a major city surrounded by a lot of treatment providers. I had a lot of options available to me. Now I live in Western Michigan, where I've got to travel a half an hour, 45 minutes just to go see a general practitioner. I don't even have access when it comes to maybe therapists or counselors and stuff like that. That's even farther away for me. And I know that Chuck, at your organization, you've done some research and you've got some statistics when it comes to access of treatment providers in small towns. And I was wondering if you could share some of that with us.
Yeah, for sure. And the situation you described, Jason, is very common throughout rural America. People find it really difficult to get an appointment. There's a severe shortage with mental health professionals and just healthcare providers overall. But some of the stats that surround that include a 20%, fewer primary care providers in rural communities when compared to cities. 65% of rural counties lack a psychiatrist, 47% lack a psychologist, and 81% of rural counties do not have a psychiatric nurse practitioner. So and along with that, there's an absence of insurance, or it's more likely to have insufficient coverage for mental health care, which is another barrier to rural mental health.
Yeah,
And
absolutely.
kind of like going into some of the lifestyle barriers, we also find that in addition to some of the geographic challenges and some of the technological challenges, there's also that lifestyle barrier of what it means to be living in a smaller community. And a lot of people that are, um, you know, in an area that's more rural, unlike if you're in a suburb or a city where your pipe breaks and you can call, pick up the phone and a van rolls up in your driveway the next day to fix it. When you're isolated and alone, you figure it out, you do it yourself. And that mindset of being independent, self-reliant, is often necessary to live and work in a rural community. But with that mindset, combined with the stigma that often surrounds a mental health condition, it can be really tough for people to reach out and ask for help. So that's a huge barrier that's kind of inherent in the rural lifestyle for many people. So people, they want to ask for help. And they're also afraid of being considered weak or incompetent. And there's also that confidentiality of being in a small, close-knit community, which can be a great thing as far as having people that might be there when you really need them. But also, a lot of times everybody knows your business, which isn't all that comfortable for some of them. I want to keep something private. And yeah, just that isolation too. It's and feeling like you brought this out as far as like you feel like a lot of times people feel like they're the only ones, that they're alone. And any marginalized segment of the population that somebody would find in a major city or a suburb, those folks are still in rural communities. They're just more isolated and possibly feel even more alone. So it's just there's a lot of unique barriers to getting the help people need just by being in a rural community.
Yeah. Yeah, I can do it on my own. I've heard that many times before, and that is that's a tough thing because for some people that is that barrier to treatment, and then for other people it's entirely overwhelming. And I know for you, Gideon, you had to do a lot on your own to find those resources and make those resources. And I'm so glad that you were able to reach out and you were able to connect with folks because unfortunately so many people think they can do it on their own, and then they run into barrier after barrier, wall after wall. So I was wondering, Gideon, could you take us through kind of your experience of accessing care and accessing that support? I know the internet was very big for you.
Yeah. So I really appreciate Chuck mentioning the fact that like a lot of mental health providers and like physicians aren't even aware of like what to do with some of these diagnoses. Like I know as an adult when like going to a therapist or not a therapist, a counselor at my local county building and saying like, "Hey, I have ARFID. Help. What do I do?" And like she needed to reach over, grab the DSM and be like, "I don't know what that is," and flip through to find it.
Mhm.
And the response was essentially like, "Have you considered just eating the things you don't like?" And it's like mind blowing. I'm cured.
Yeah. Yeah, I've heard it before from people who say it's like a switch. Why don't you just start eating again? Flip the switch. And it's like it is not that easy. So many individuals, even treatment professionals out there, don't realize the complex nature of eating disorders.
Yes. And so for me, a lot of treatment was one, finding my community, realizing I'm not alone, and seeing what other people were doing as far as like food exposures. I that also led me down the path of finding health at every size and intuitive eating, which those were really beneficial when it came to the anorexia aspect of my eating disorder because I've always been in a bigger body. And so often, whenever I mention, like, hey, I don't think this is right, it was like, but you're fine. You can stand to lose weight. So finding health at every size and realizing that really the fear mongering from like pediatricians, they were off base. And, just because I'm in a bigger body doesn't mean I'm innately unhealthy. I have 27 years of proof and experience saying I am healthy.
Yeah.
And also intuitive eating and kind of using that reasoning of, well, if I follow my hunger cues and I listen to what I'm craving, I'll be better for it because one, my body is going to learn I will listen to it. And two, I kind of like trying to work with the eating disorder on that one and saying like, well, if I just eat what I want in the beginning, then I won't eat more later.
Mhm.
And trying to like get that buy-in from the anorexia.
Yeah, and as you were talking, I got to thinking about here at ANAD how things have shifted over the years. Prior to the pandemic, all of our support groups were in person. And now, since the pandemic, they've gone virtual, and we've kept them virtual for reasons like you just shared, because it gives you the opportunity to make those connections. And now, somebody that's living in a town of 5 people can connect with somebody who's living in a town or in a city of 5 million people. And it's so important because topics like that come up in our support groups all the time, health at every size or intuitive eating. And it's those types of conversations that I'm so glad we're able to bring to each other now through platforms like Zoom or the internet. But I know that also rural America lacks broadband access, and there are barriers there. So I was curious, Chuck, if you could elaborate a little bit more on that, and maybe where people can go to find some of those resources that they might need.
Yeah, well, many people in cities and suburbs are used to meeting with a healthcare provider online, which of course saves time and money. But in rural America, nearly 30% of homes lack access to broadband internet. And for many who do have access to the internet, the service can be unreliable or expensive. So this all adds to the barriers of potentially, having the option for a telehealth appointment. But to the point of all the amazing resources that are online, the Rural Minds website, and the address is ruralminds.org. All of the content there is free and accessible, and most of it is printable. So it can be a PDF that people can download and print off and share with people that maybe don't have access to the internet. And I think, in addition to a lot of information that's specific to the rural mental health challenges, there's also online access to a portal of content that's public facing, and there's just a lot of great information from so many mental health nonprofits that have been there long before Rural Minds, and in addition to many other organizations that have great free content. So part of what we do at Rural Minds is we do not reinvent the wheel. We want to give a nod and easy access to this information online, but we also want to identify, so what are the gaps that are, what are we missing for providing people in rural communities with all that they need for managing these challenges and getting the help that they need. And so that's where our focus is. But some of the challenges are common to people no matter where you live. So the portal that we have at realminds.org is specific to three different subsets of information and resources. The first is a webpage that's specific to crisis resources and support. And at the top of that is the new, well, it's not new anymore, but it's still not all that well known, 988, the three-digit calling code for 24/7 mental health assistance. There are trained therapists that answer that, whether you're texting 988 or calling it. There's also a chat at 988lifeline.org. But the point is that it's not only an invaluable and potentially life-saving resource for someone who's in a crisis, but anybody can call at any time to ask a question, whether it's your question or asking a question of a loved one or friend that you care about and you're not sure how to respond. So that's invaluable. In addition to 988, there are many other resources on the Rural Minds website specific to crisis resources and support. And then we have two other pages. One is mental health resources by topic, which makes it really easy to just scroll down alphabetically and find what you're most interested in. Click the drop down, excuse me, and then you've got all these different links to organizations and resources, numbers to call, places to check out online. And again, all of this is printable as a PDF. And then the final one is just mental health resources A to Z. So if you're looking for a particular organization, it's easy to find that way too. So there's a lot of great resources, but and we try to recognize that while not everybody has access to the internet, hopefully by having the option to print these PDFs and handing them or mailing them to someone you care about or maybe looking for information is a nice option.
Yeah, yeah, absolutely. And that brings up a really good point. And it's something that I've been trying to do here at ANAD is be really mindful of when we're putting content on our website, make sure that it is downloadable or that we can put it in a PDF format for people who might not have access to the internet. I've had people reach out here who have said, can you send me the PDF of some of your blog posts? I have limited access to the internet and I'd like to download this and read it on my own time. And it's one of those things that I encourage, if there's other mental health organizations out there listening right now or other nonprofits, be mindful of that when you're thinking about accessibility, that there are some people out there who need to have these materials printed for them. So anything we can do to make getting that information even easier, it's the best thing we can do. So, Gideon, I'm gonna shift the conversation back over to you again, and I would just love to get one thing that you would like to share with other individuals out there who might be struggling to find resources or might be struggling with an eating disorder. What would you say to them?
I think the thing I would say is I know it's a really tough path and it can be so isolating. But as cliche as it is, you aren't alone. There are entire communities online for this, for you. And, there is that light at the end of the tunnel. I also know, like, especially within the field of eating disorder work, there's a lot of emphasis on like a complete recovery. And I just want to hold space for the people who, right now, complete recovery isn't an option. And that, like, it's tough, but you're still valid. And I know, like, you're so strong.
I love that. I feel like mic drop right there. Like that's a powerful statement right there. And thank you so much for coming on today and for sharing your story because like Chuck mentioned at the beginning, it's through sharing our stories that we're going to break through this stigma and we're going to normalize these types of conversations. So I was really grateful when I was able to connect with you and you were willing to come in and share your story. Chuck, I would love for you to share just a little bit more about your organization and how the rest of us can get involved. What can we do to help support you and to help, attack that stigma and change this conversation so that we can have these openly and without shame or fear?
Well, thank you. Yeah, and that's so important. And at the core of Real Minds is we are all about partnering, and this is a huge initiative as far as mental health, mental wellness across the board, and in rural communities too. So we really are appreciate opportunities to have these kinds of conversations and to partner with individuals, with organizations. Rural Minds is the only national 501c3 nonprofit that's focused on providing free information and resources to confront rural mental health challenges, along with the stigma that surrounds mental illness for the 46 million people who are living in farming, ranching, agriculture communities, small towns, isolated areas across rural America. And, there within this area, there truly is a rural mental health emergency. And compared to people living in urban areas, rural Americans have higher rates of depression, higher rates of suicide, but they're less likely to access mental health care services in part because of some of the things we've already talked about. But I think the stat that really drives home the emergency aspect of this is the latest research from the Centers for Disease Control and Prevention, the CDC. And they found that suicide rates among people living in rural areas are approximately 65% higher when compared to people living in large urban areas. And while it's important to recognize that, we don't want to just alarm people. We really, the work that we're doing is to provide the information, the resources, so people can respond to that. And we know that there's the shortage of rural mental health care professionals, and that, and combined with recognizing this independent, do-it-yourself mindset that's really common in many people who live in a rural community. Rural Minds has developed the Rural Mental Health Resilience Program, and the content was created really to empower people with the information, the tools they need. So wherever you're living throughout a rural community in this country, there's an opportunity to take it upon yourself to be part of the solution to confronting rural mental health challenges and doing what you're comfortable doing in terms of accessing the resources, the materials, the toolkit that's part of this program. And it's, as I mentioned, it's online. It's access to free, culturally relevant you know, focused on the rural perspective as far as the mental health information, the resources to recognize some of these unique barriers that we've talked about that are specific to living in a rural community. So again, ruralminds.org. It also features recorded content from the Rural Mental Health Connections webinar series. A lot of great conversations with people sharing their personal lived experience of different mental health conditions, living in a rural community, combined with mental health experts who weigh in on additional information and content as far as how to confront those challenges and those conditions. And then we have another program about suicide awareness and prevention, along with we've recently added tips on how to manage isolation and loneliness. That's actually on the main page of the website. There's a link to some information that's about, you know, all about that topic, and we did touch on that during this conversation too. But everything's available at no charge, and folks can also sign up to receive the Rural Minds newsletter, follow us on social media. But I'm happy to do it, and we also have an info at email address. So if anyone has questions, if we can provide more information, we're always happy to do that, and all about partnerships. So thanks so much.
Amazing. Well, thank you for all the work that you're doing. And I was very excited when I came across your organization and then when we were able to connect and make this partnership and collaboration happen. And this is just the first of many. This is the first of many conversations that we're going to have about this topic. Because there are so many more questions that I have, and I know so many more questions that other folks who are watching right now probably have too. But we're running out of time here today, but I want to thank you both, Chuck and Gideon, again for the incredible work that you're both doing to erase that stigma and to help other people. And it's been an absolute pleasure to talk to both of you today.